Hi, I'm Dr. Danett and welcome to Yoni Box. So today I'm going to talk to you about a topic that plagues many of us as women. In fact, it's estimated that 70 to 80% of us will have to deal with it by the time that we are 50 years old, and that us African American women are 3 times as likely to get them, and those are fibroids. But there are options and ways to address fibroids, so I'm going to be talking to you about that today. So the name of this video is Hit the Road Fibroids and Don't You Come Back No More, because that's what we really want to have happen with them. Even though fibroids are benign tumors, they can cause issues including heavy periods, which is really not great for us as women, because leaking blood is something from a traditional Asian medical standpoint is really not good for our health. And based on the placement of some fibroids, they can interfere with a pregnancy. So, those are some of the reasons why it's good to address fibroids. So let's talk about how I help people. So when a woman comes to me for assistance with her fibroids, the first thing I need is your lab work. From that, I can assess how well I will be able to help you, or may be able to help you using the training that I have, which is as a traditional Asian medical doctor who specializes in women's health. So I see your lab work, and by looking at the size, the location of the fibroid, the amount of fibroids that are shown from your test, then I can say more about how I can be of assistance to you, and also just how it's affecting your quality of life. For some women, the fibroids really are not affecting their life, their cycles, and so that's a different, we still want to address it, but that's different than, say, for instance, a woman who is bleeding half the month or more. I mean, that's just not desirable. It's not fun for the woman, but it's also really, really bad for her health. So the first thing is establishing where things are currently in terms of the type and size of fibroids, and then also how it's impacting your life. And then from that we can see, because honestly, to shrink fibroids, we use acupuncture. You definitely would have to be on an herbal formula, and you would have to strictly follow certain nutritional recommendations to make it the most effective in terms of shrinking fibroids. But again, it comes back to that first step of the size and the amount and so forth, and the amount of fibroids that the woman has. And based off of that, then you get to make the decision in terms of, if I say I can help you, if this is what you want to do, and or if you decide to do a Western medical procedure to help to shrink them and to or to have them removed. I'm not in any way advocating for hysterectomies, although every woman is very different. That's not what I'm talking about. I'm just talking about any fibroids that are troublesome, and if they are beyond the size that Asian medicine typically can help with, and it's causing issues, then these are things that you have to weigh. But I will, tell you more about how I can be of assistance. I have had women come in who, because of the size and location of the fibroids, decided to have procedures, and I was still able to help them by strengthening their system prior to them having the procedure, and their doctors were pretty amazed at their recovery. Tended to be a lot quicker than other patients. So if you are thinking about, having a procedure, or, you talk and that's still something that you decide to do, then acupuncture and the different treatments that we do can be helpful with having your system be strong and be able to recover more quickly if you decide to have a procedure. Then the next step is very important, whether you took the traditional Asian medical or natural remedies, you took that avenue, or you took the avenue of having the fibroid shrunk or taken out by Western medicine. However you choose to address them, the next step is very important, and that is preventing the growth of fibroids. So there are many reasons why we get fibroids. You know, genetics plays a role, the different phthalates and different substances, unnatural substances that were introduced to our bodies play a role. Emotions definitely plays a role. All these different things play a role. So in terms of setting up a regimen for you to help to prevent fibroids, we look at different factors, and then I make some nutritional recommendations. I may have you take an herbal formula. It might be something that you're not taking every day for the whole month, but it is something to help to keep the factors that can produce a fibroid, to help those things to be more balanced, so that the likelihood of them redeveloping or developing happens. So there's that. And then I strongly recommend regular acupuncture sessions. Not everybody is able to come in weekly, and if you're doing a preventive care regimen for fibroids, then you wouldn't need to come in weekly. But based on your overall health, then I would say to you, okay, maybe you need to make sure that you're coming in once a month or once every 2 weeks, or based off of what your cycle looks like. There's some patients who I always make sure see me before their cycle or after their cycle. So it depends on different factors, but that last step of a good preventive care regimen is very important in helping to make the fibroids not interested in coming back, not giving them a space, and giving them the things that tend to feed fibroids. For certain, a lot of the white products, white flour, white sugar, dairy, the things that tend to create phlegm and mucus and dampness in the body from a traditional Asian medical standpoint are some of the things that I say to avoid. I remember that if you go to my website, yonibox.com, where the blog is, and you enter your email address, you will receive our free Fibroids Prevention Guide. So that has even more information about certain nutritional suggestions and so forth, things that you can implement on your own. And so that pretty much takes care of what I was going to talk about today. I believe that this is something that's important for us to address as women, particularly if it is causing your cycle to be heavy or interfering with the quality of your life at all. It's very important to address. It's good to address it sooner than later. And there are options out there, so it's very important for you to know the options and be able to make a good decision. And I'm happy to provide you with information from a traditional Asian medical standpoint that can help you as you make the decision, but it's very important, as I said, to address. So take good care. Oh, and if you have questions, if you'd like to set up an appointment, or you have health concerns or questions, you can email me at drbean@backtothemiddle.com. That's DRBEAN @backtothemiddle.com. You can also visit our website, backtothemiddle.com, for more information about our services. You can set up an appointment there as well. And I hope you take really, really good care. And till next time, enjoy being a woman.